So, a very good morning, everybody. Uh, the topic of my presentation is oral steroids in retinal vein occlusions. So, like, firstly, we'll see few of the cases. Like, here is a 61-year-old hypertensive who came with the complaints of diminution of vision in the left eye for the past 2 weeks, and the vision in the left eye was 618, and anterior segment was normal. And then the fundus in the left eye showed superiotemporal branch retinal vein occlusion with macular edema. And then, like, as a classical treatment of vein occlusions is like if there is any associated macular edema, we usually inject an intravitreal anti-VEGF. Or if no macular edema with associated neovascularization, we do a sectoral laser photocoagulation. So, like, this was the treatment. Like, firstly, like, actually he received an injection, and then, like, in actually luckily first month post injection the edema got resolved, and then again at 3 months the edema recurred back. So, and then again he received an repeat injection, and then we like actually we had to give actually 3 doses of injections. So, and then this is the case 2, likely wherein a 59-year-old diabetic, like, who came with diminution of vision in the right eye for the past 1 month, and the vision in the right eye was 6/12, and anterior segment was normal. Fundus showed right eye superiotemporal branch retinal vein occlusion, and then like again the plan was to inject intravitreal anti-VEGF. So again, like, we had to give actually 3 injections. Still the edema did not resolve. So, like, what are the limitations of anti-VEGF injections? It's only like, it will usually treat the manifestations, but like, and prevent the late complications. Does not really act at the basic pathology, and then we'll need multiple injections, which is also troublesome for the patient. So, like, is there a way out? So, and then we wanted to evaluate the efficacy of oral steroids in retinal vein occlusions, like both central and branched. So, and then the parameters considered were the visual acuity, central macular thickness, and then the vascular remodeling. So, like, all patients diagnosed with central and branch retinal vein occlusions after fundus evaluation, the BCVA was recorded, and then, like, all those patients underwent radial macular 9x9 mm OCT scans for central macular thickness, and then fundus photos were also captured. And then, like, after a thorough systemic evaluation for oral steroid contraindications, was started on oral steroids at 1 mg per kg with actually 10 mg weekly tapering. And then those with uncontrolled diabetes, like active systemic infections, and then actually pregnancy and actually postpartum patients were excluded. And then, like, we'll see few of the cases who were treated with oral steroids. Like, here is a 53-year-old hypertensive who came with diminution of vision in left eye for 5 days, and then the vision was 618, anterior segment was normal, fundus showed superiotemporal BRVO with CME. And then the patient was started on 60 mg of oral steroids with weekly tapering, and then, like, almost for 2 to 3 months the patient is still actually stable. So, and then here is a case 2, a 48-year-old with actually diminution of vision in the right eye with vision of 6/24, and then the fundus showed superiotemporal RVO with CME. And then again the patient was actually started on 50 mg of oral steroids with weekly tapering, and then almost actually 2.5 months the patient is still maintaining stable. So, and then this, so, and then the left side is a patient to actually begin with, and then at 4 months this is the fundus and the OCT. And then, like, here is a case 3, who's a 47-year-old, like, who came with diminution of vision in the right eye, and the vision was 660, and the diagnosis was CRVO with actually cilioretinal artery occlusion. And then the patient was actually planned to start with 60 mg oral steroids. And then actually this is a case 4, like, so, and then we can see, like, at presentation the vision was 660, and then, like, actually 2 months later it was actually 69, like, who was treated with oral steroids. And then this is a case 4, a 53-year-old with like, with central retinal vein occlusion with CME, and then like, again the patient was treated with 70 mg per day oral steroids. And then even oral steroids can aid in actually vascular remodeling as well. So, like, this is actually like one of the case of central retinal vein occlusion with CME. And then this is the actually fundus photos, like actually sequential fundus photos after starting on oral steroids. So, and then this is and then again this is one of the impending case of CRVO. And then we can see the actually vascular remodeling. like over the course. And then this is a case of central retinal vein occlusion with actually cilioretinal artery occlusion. So like this was a fundus photo at the time of actually presentation, and then this was almost a month later, and then this is almost actually 3 months later. So like again, this is one of a case of central retinal vein occlusion. Actually the left side is at the time of the presentation, and then the right side is almost a month later. So and then the results are, we had actually 12 cases in total, like 8 were branch retinal occlusions, and 3 were CRVO, and then 1 was CRVO with cilioretinal artery occlusion, and then 7 being males and 5 being females. Like all 12 patients showed significant reduction in central macular thickness as well as improved vision. And then all 4 cases of CRVO showed significant vascular remodeling in the due course. And then actually 3 patients had recurrent CME, and then like we had to actually resort back to like injecting anti-VEGF. So like the discussion is like alteration by any factor like inflammation in most of the cases, like in as described in actually Varco's triad, actually can lead to actually vascular insult. Like oral steroids, like will aid in remodeling the vascular insult, insult if instituted at an early stage of the pathogenesis by decreasing the inflammation. In most of our patients on oral steroids, we could prevent multiple intravitreal injections, including anti-VEGF and also steroid injections. And in those who were previously treated with anti-VEGF or Ozurdex and like had recurrent CME, like we had initiated with oral steroids and then like decreased the need for the multiple injections. Like I mean, it increased the frequency of the injections, like but we couldn't avoid it fully. So and then the conclusion is oral steroids is an effective treatment option for all types of retinal vein occlusions. However, systemic evaluation and excluding those with contraindications to oral steroids is equally important.